Hey guys, Dr. Gary here. So let's talk about combining lip lifts with other procedures. A lot of times I get asked about, can I do a lip lift with a rhinoplasty? And then some people want a lip lift with a facelift or a lip lift with some other things. And so I wanted to kind of touch base about these sort of combined procedures and what's possible, what's better to kind of wait on, what can be done at the same time, what sometimes you should do first. So let's kind of jump right into it. First thing will be a rhinoplasty. Yes, you can combine a lip lift with a rhinoplasty. Dr. Spiegel did a study on this looking at the incision placement, and he confirmed after hundreds of cases that it's a very safe thing to do. Like the area will heal fine, because remember, the lip lift scar is at the base of the columella, whereas for like an open rhinoplasty, for example, the incision is at the mid columella. So they're slightly separate, and there was some concern in the community, what about that skin bridge that remains in between? Like, will that skin bridge survive, or will the vascularity be affected? And I think Dr. Spiegel's study kind of put that to rest. In real practice, most of us who are doing a lot of lip lift surgery, we're also combining it with rhinoplasty and seeing that it's very safe to do. But the issue is, should they be done at the same time? The advantage is that it's one recovery, and people like that, right? They like that they're coming in, they're going to sleep for the rhinoplasty. You can just do the lip lift at the same time, one recovery, and then they get their result that they're hoping for. Yeah, in an ideal world, that's how it would work, right? But what I advise patients is to actually do the rhinoplasty first, wait 3 months, and then do a lip lift. And I'll tell you why. When you do a rhinoplasty, oftentimes the muscle attachments of the lip are kind of disrupted, or at least partially disrupted, because of all the manipulation to the septum, which is that central portion of the nose. So when we're working on the nose, we're digging around at these like muscular attachments, and a lot of times they get disrupted, and then what could happen is that the upper lip can actually fall. So that is one issue. The other issue is, a lot of times with rhinoplasty, we're elevating the tip. We're raising the tip a little bit. Some patients come in with a droopy tip. We're raising that tip, and again, exposing more of the philtrum. So now you can get more philtrum exposure from the muscles being affected and from the tip going up. And you don't know exactly how those changes will result. It's not like you can totally see it happening on the field. Some of those changes occur more over time. And so my preference is to do the rhinoplasty, wait 3 months, see what the changes are to the upper lip, and then do the lip lift under local anesthesia. That makes the most sense to me, and that has worked well in my practice. That's my preference in terms of ordering those two procedures, but it is safe to do it at the same time. I just don't think it's the most effective thing. And then if you do the lip lift first, and then you do a rhinoplasty later, again, the rhinoplasty can have all those changes that I just talked about, and then you might have to go back and do a lip lift revision, because now your upper lip is longer again. So I think rhino first, be happy with that, and then do the lip lift. That would be the ideal. Now, what about an alarplasty, right? That's kind of one of the caveats here. The alarplasty addresses the base of the nose. It's like the actual ala down here, and it's tricky because when I do a lip lift, I'm staying just outside of that crease to not create any webbing. And then when you do an alarplasty, you're usually kind of going right into the crease. And so you can't really do both surgeries at the same time unless you kind of compromise on those two things. There are some people that combine those surgeries. I personally never combine alarplasty with a lip lift. I've done it before and I haven't been too happy with the results. And the reason is this: as the alarplasty kind of heals up, aside from just the incision place, but as the alarplasty is healing up, the forces of contraction and healing are kind of north, they're going up. With a lip lift, because of like the pulling on the upper lip that occurs as just, with everyday activities, the force is going down. So now you have one surgery where the healing is kind of going more superior or up, and another surgery that's causing some forces downwards. And when you have that type of clash, you can get some widening of your scars and potential webbing. So I don't combine those two surgeries. I find that it's better to do them separate. In terms of timing which one to do first, I don't think it completely matters, to be honest. So I'll give people the option, if they want to do an alarplasty to narrow the base of the nose separate from a rhinoplasty, then we'll do the alarplasty either first and the lip lift second, or lip lift first, alarplasty second. Going back to the rhinoplasty lip lift discussion, if we're doing those at the same time, I'll never include the alarplasty. That's something that would then have to wait, because again, it's important to uncouple those two surgeries, in my opinion, lip lift and alarplasty. So next, let's talk about a facelift. So what if someone wants to get a facelift, like they're, kind of further along the aging process, they have some jowling, they have some neck laxity, the corners of the lips are sort of down, and we really want to just revolumize the face and to kind of put it back to where it was and shorten the philtrum, right? So we want to do a lip lift and a facelift. Can that be done safely? The answer is yes. Those areas don't really fully impact each other. The facelift, especially performed in a deep plane, can take the corners in certain cases and re-elevate them and address that portion of the kind of aging process, and you can get the lip lift done too to bring the philtrum down or shorten that philtrum. So yeah, those two can be combined. I've done that many times in my practice, and that works very well. It adds obviously some surgical time, but I do believe in combining those for sort of like one kind of recovery. I think that's a great combination for the right patient. Of course, you've got to be a facelift candidate and you have to be a lip lift candidate, but if you are and you're willing to kind of go through both, then I think that's the way to do it, And then for when I do combined surgery, I usually discount, kind of the overall procedure, and I think most doctors do that. So you can find yourself paying a little less than if you kind of break everything apart and do it all separately. So I think that's a really good combination, facelift and the lip lift. Now, what about getting some injectables done, especially with filler? Some people ask me, like I'm going for the lip lift, so can we also do some cheek filler at the same time? I tell them no, because I think that it's just better to focus in, do the lip lift, and then come back in when they're a little bit more healed to do filler. I think the filler kind of delays healing a little bit because the filler also causes some swelling, and now that's trying to kind of drain through the same pathways as the lip lift swelling. So my personal preference is to wait on the filler about 3 months, especially if the filler is going into the lips, because I want the person to heal well from the actual lip lift surgery. So filler usually we put on the back burner for a few months and revisit that once they're more healed from the lip lift. Now, how about mole removal? And this might be a strange thing to think about in combination, but I've been seeing a lot of patients that have different like birthmarks around the mouth and especially on the upper lip. So they want a lip lift and they also want me to remove a mole. A lot of times we can combine those things, but sometimes we can't completely remove the mole in the same excision. So we can remove the mole, but let's say it's a little bit closer to the actual vermilion border. We'll have to do that as a separate excision. It could be done on the same day, but it's a separate excision than if the mole is much higher up and we can actually remove it with the excision of skin with the lip lift. So that's kind of a case-by-case basis, and it depends on the size of the mole, on the exact location of the mole. And I have a YouTube video on mole removal of the upper lip. That patient did not get a lip lift, but it's I think a pretty cool video to check out. It's kind of like a surgical point of view video, so make sure to check that out. Now, what about submental liposuction and doing that at the same time as a lip lift? Because some people, especially nowadays in 2021 with all this COVID stuff, people have been, cooped up at home and they feel like they have a little extra tissue, a little fat here, and they want to get it liposuctioned away. So yeah, I've done that type of combination. Again, pretty often lip lift, submental lipo. It works well. I haven't found any problems with combining that, and that those two are both done under local anesthesia. So a lot of people like to just avoid the operating room and avoid anesthesia and the costs and the risks and all that, and that's something we can do both under local. So I like that combination for, again, the right patient, submental lipo and a lip lift. And then lastly, I wanted to talk about laser treatments. Some folks come to me and they have, they have the long philtrum, but they also have a lot of these vertical lines, and sometimes they have other signs of skin aging on the rest of their face, and they want to know, can we do the lip lift and can we then also do some laser resurfacing at the same time? And my preference is to do the lip lift and then have them come for resurfacing, again, like 3 months later. And the reason is because then you can also resurface the scar. Because if we do the resurfacing at the same time as the lip lift, first of all, the area here where we worked and where I undermined underneath for the lip lift, I don't really love to treat that with laser at the same time. And also, like, if you're going to need the laser down the road for the scar anyway, I think it makes more sense to hold off, do the laser treatment later on, and the laser is what can help you with a lot of those little vertical lines that can sometimes form with time. And then you can also treat the whole face, at once. That's my preference for tackling laser kind of skin resurfacing and how that interplays with the lip lift. So again, hopefully you guys found that useful. There are of course other combinations that you can come up with and that we've done before for lip lifting. One other one that I'll say would be a hair transplant with the lip lift. That's come up a few times, and I will not do those at the same time, because for the hair transplant you've got to be like on your face, and then we flip you over, you know, once we get the hairs to put them here. There's just a little bit too much going on, and hair transplants just take a long time, so I don't like to kind of throw a lip lift into that mix. Those will do separate, you know, space those surgeries out as well. So again, hopefully you guys found that useful. These different combinations come up quite a bit, and I just wanted to kind of elaborate on that. Please make sure to like the video, subscribe to the channel, and see you guys soon. Later.